Hello everyone. From today, I'm going to start a series of Ayurvedic topics, and in today's session, I'm going to explain about the introduction of Ayurveda. What is this Ayurveda? What it contains? How its treatment? Everything. The detailed knowledge of Ayurveda. In today's session, we will get to know. Initially, what is Ayurveda? Ayu means life and Veda means knowledge. The knowledge of life is nothing but Ayurveda. It is an art and science of healing. It literally means to know about life. Life means everything. It may be lifestyle, it may be diet, it may be activities which we do, it may be sleeping, it may be get upping. From birth, first day till death day, whatever activities we do, everything will be explained in Ayurveda. What we have to do, what we have not to do, and if what like what diet if we take, how our health will be upsetted or it will get disturbed. Everything will be explained in Ayurveda. How old this system is? Actually, we have a story of Samudra Mantana at the days of gods and devils in Treta Yuga. So at that period, in Samudra Mantana, they say that Dhanvantari, who is the god of Ayurveda, they came into existence. They came out from that Samudra, and they were holding the Amrita Kalsha in their hand. This Amrita Kalsha is nothing but the treatment of Ayurveda, they believe. So from then, our Ayurveda practice started. So they we believe Dhanvantari, Acharya Dhanvantari or God Dhanvantari has the father of Ayurveda. This god Dhanvantari are incarnation of Vishnu also, they will say. And this Ayurveda practice was started 5,000 years ago. Initially, it was started as home remedy, it was started as local treatment, something else. As technology developed and research developed, our Ayurveda started in the form of medical field treatment. What points you have to know particularly about Ayurveda? Some myths, nothing but some myths we have about Ayurveda. Not merely a herbal medicine, or it is a folk medicine, or beliefs system, or alternative medicine. These all are myths about Ayurveda which we are hearing or it's roaming around us. What are its aims? Actually, we have a shloka in our Ayurveda about the aim of Ayurveda, that is Swastasya Swasthya Rakshanam Aturasya Vikara Prashamanam, means who are healthy, to keep them healthy in a preventive aspect, and who have already disease like ill health or complaints, to treat their complaints. Also, the Ayurveda will work as curative aspect. So Ayurveda works on preventive aspects also and curative aspects also. If a person is healthy person, Ayurveda will advise them a preventive medicines to be healthy only, and who already have a complaints, Ayurvedic medicines will treat their complaints. What is its scope? Scope is nothing but how well developed it is. Obviously, especially after Corona, we are seeing everywhere Ayurveda spreading like anything. It is spreaded worldwide, and also we have different forms of departments. Like in modern, how we have the separate departments of particular treatment. Even in Ayurveda, we have Ashtangas. Even nowadays, it's developing more than 8 branches also. And it treats not only humans, it have a specific points about animals, cows, horses, or even about the plants also, a healthy plants, how they should be and how they will treat us in our complaints also, they explained. What are its specialized branches? As I said, Ashtangas we have in Ayurveda. It is Kaya, Bala, Graha, Urdhvanga, Shalya, Dramshta, Jara, Vrusha. Whereas Kaya is general medicine, Bala is pediatrics, Graha Chikitsa, that is demonology, that is invisible causes or microorganisms, we can say. Urdhvanga, that is ENT, and actually ENT it was combined with eyes before. Nowadays it's divided, ENT separate, eyes, ears, nose, throat separate, and ears, nose, throat separate, and ophthalmology, that is eyes, is separate. Shalya, that is surgery. Damshta, that is toxicology. Jara Chikitsa, that is geriatrics, and Vrusha Chikitsa, aphrodisiac. This Jara and Vrusha, Jara acts as rejuvenation, preventive aspects or supplementaries, and Vrusha treats especially the infertility cases. What is its basic approach? Obviously, to maintain a healthy person in a healthy way, and it will cure the diseases. Is Ayurveda based on any literature? Obviously, yes. We have many acharyas who wrote Ayurvedic literature in their own form. In those, these six are very important, who explained Ayurveda well versed. It is Charaka Samhita, Shushrusha Samhita, Ashtanga Sangraha or Ashtanga Hridaya, and Kashyapa Samhita, Madha Nidana, and Sharandhara. Even for this Charaka Sushruta Ashtanga, we will say Brihatrayis, and Kashyapa, Madhava, and Sharandhara we say even like alternative. Like in Charaka, we have especially they explained about the general medicine. Sushruta, especially they explained about the surgeries. And in Ashtanga, overall about Ayurvedic knowledge we have. Kashyapa explains particularly about the children's specialist like Balarogas. Madhav Nidana especially about the diseases, and Sharandhara again overall Ayurvedic medicines they explain. So these are the main textbooks or main samhita like literatures which we have about Ayurveda. What is the best through Ayurveda? Obviously benefit is, as we follow preventive and curative aspect, nowadays we can see even in 20s 30s ages also they are getting ill with other reasons, or the trending complaint is about the heart attack and they are dying. But by following purely Ayurveda, we can be healthy and we can have longevity of life. Why we want longevity? Obviously, if we ask our ancestors or our grandmothers, grandfathers, they will say, what is the motto of living? To attain all these four, that is in Ayurveda we say Chaturvidha Purusharthas, that is Dharma, Artha, Kama, and Moksha, right? So to attain this Dharma, Artha, Kama, Moksha is main motto of our life. So to attain this main motto of our life, our Ayurveda will help. So now coming for Ayu, we got to know life. Then what is this life? Nothing but a human being. Sharira, Indriya, Sattva, and Atma. That is body, sensory organs, mind, and soul. All the combination of these will create a life, a human being. That is nothing but a life. But how to maintain this Sharira, Indriya, Sattva, Atma will be explained in Ayurveda. Important factors in the body, like to treat a body or to understand the body. Body is nothing but here life, which we saw 4 points. To understand those 4 points, to maintain them in a normal way, we have to know these points. That is 3 doshas in our body, that is Vata, Pitta, and Kapha. And we have Sapta Dhatus in our body, that is Rasa, Rakta, Mamsa, Medha, Asti, Majja, and Shukra. And 3 malas, that is excretes, Purisha, Mutra, and Sweda. Depending on all these 3 points, that is dosha, dhatu, and mala, our body will be functioning. So if we know exactly what these doshas, what are dhatus, and what are malas, then we can maintain the body in a correct way. Ayurveda theory of health is based on 3 dosha, as I said, and sapta dhatus, and 3 malas with the combination of pancha mahabhuta. What are these pancha mahabhuta? To functioning of these dhatus, doshas, and mala in a correct way, we need pancha mahabhuta, that is akasha, vayu, agni, jala, and prithvi. So dynamic balance of 3 dosha, sapta dhatu, and 3 mala creates health, but the functioning of these 3 will be dependent on pancha mahabhuta. So causes for disease, what will be the causes for disease? One thing about time, that is irregular to season if we have anything, or irregular to our daily routine if we have anything, we will get disease. Or due to this cause, if our sensory organs get disturbed, we will cause disease. And shodhana karma, deeds, through our wrong activities we will have diseases, right? So this kala, ardha, and karma, if these 3 we have, we do the activities in less, also we will get disease. If we don't do in improper, also we will get disease. And if we do excessive, then too will get disease. What is the principle of treatment in Ayurveda? Actually, in Ayurveda, there is 2 forms of treatment, that is Shodhana and Shamana. Whereas Shamana, in Shamana way of treatment, we will give oral medicines according to our Ayurvedic protocol, which complaints, which disease should be mentioned. And in Shodhana, we do procedures, Panchakarma procedures, to expel all the vitiated doshas or vitiated things in our body will be expelled out, then the oral medicines will be given in Shodhana Karma. So Ayurveda treats the disease in two forms, that is Shamana and Shodhana. And the types of treatment in Shodhana and Shamana are Daiva Vyapashraya, Yukti Vyapashraya, and Sattva Vajaya. Whereas in Daiva Vyapashraya, Manasa Rukas, nothing but like Homa, Havana, curative aspects. In Yukti Vyapashraya, medicines. In Yukti Vyapashraya, this Shodhana and Shamana. This Shodhana and Shamana will be included. And in Sattva Vajaya, they will treat the patient according to the Manasika, according to their psychotherapy method. So as I said, Shamana is pure, specifying, and Shodhana is eliminatory, and Swasthaita, that is Rasana and Vachikarana, as I mentioned, rejuvenation therapy and aphrodisiac. Unique contribution of Ayurveda. These all which we saw, the forms of treatment will be depending on medicines, right? But whereas our Ayurveda has a unique concept called Dinacharya Rutucharya, in which they will advise the daily routine diet and daily routine activities, and Rutucharya in seasonal activities they will mention, in this season this only you have to do, in this time this only you have to do. If you follow that Rutucharya and Dinacharya perfectly, a person will never fall ill in a life. And another point is Dharaniya and Adharaniya Vegas. Obviously, the activities which we have to suppress, the activities which we have to not to suppress, they mentioned in Ayurveda. And Sadvritta, that is Achara Rasayana, supplementaries or rasa, like longevity, to attain the longevity of life, some supplementaries or some steps they advised. And incompatibility, Viruddha Ahara. Our Ayurveda have some concept of Viruddha Ahara, like some diet should not be mingled with other diet. Best example is, usually what we do, we will have a raw egg and we will have 1 glass of water. But according to our Ayurveda, we will have raw egg and we will have 1 glass of milk. But according to our Ayurveda, we should not do that. It will suppress our digestive capacity and it will create ama, that is indigestion in our body. So like this, we have many Viruddha Aharas which they mentioned in Ayurveda. We have to keep some points on that. So if we follow unique these points, that is Dinacharya, Rutucharya, Dharaniya, Adharaniya Vegas, and Achara Rasana and Viruddha Ahara, a person will be healthy for lifelong. They will never fall ill. So these are some points of Achara Rasana. In this Achara Rasana, physical, mental code of conduct, or maintaining personal and social harmony, or proper sleep and wholesome diet, control over senses, they will be explaining. So this was about the brief knowledge about Ayurveda and its introduction, and what all points are explained in our Ayurveda, and if we follow Ayurveda, what all benefits our Ayurveda will give. Thank you.